Welcome all.
So, good morning, friends. So, we are now on the day of this ADOLESCON. Let me congratulate Dr. Naveen Nichal, sir, the chairperson, Secretary Samir Shah, sir, for this very innovative conference, well thought academics, and this venue is superb. Let me introduce Dr. Neelam Mohan, ma'am, shortly.
Yeah, please.
Ma'am is, you all know,
The-
she's the woman of substance. She is the woman at the moment in Indian Academy of Pediatrics. She is president-elect of Indian Academy of Pediatrics for this year. And next year will be the most happening year. You all know she is a national, international speaker, and she is the renowned pediatric gastroenterologist. So here we are. So over to you, ma'am.
Thank you so much. It's lovely to have chairpersons like Amol and Ashe. Ashe has been my student, and I'm given to understand he's doing pretty well. So I guess when the student does well, the teacher feels proud. कि ठीक पढ़ाया. And Amol is the future where we are seeing him in a lot of administrative roles. But today I'm very pleased to introduce a beautiful panel of experts who have been given to me. And mind you, please note that they are from different parts of the country. Again, emphasizing on inclusivity and diversity, which is the goal of IAP. So we have Vijayji from the same state, Prashant from Bhubaneswar, Somashekar from Bangalore, and Sulba from Maharashtra, Nasik. And we have all been introduced to you all. And I will ask you all that how often do you see a scenario like 14 years old girl with a BMI 95th centile, she's struggling with bullying in school and spends 6 hours on screen. How many of you see this every week? So I'm surprised that there were no hands which were down. Predominantly, it's become. So, Prashant, do you think it's a growing challenge that they are also talking about it?
Yeah, thank you, ma'am. Thanks for the opportunity. Yeah, obesity is really a growing challenge for the country and as well as for the global. The NFHS data, now we have a lot of evidence. NFHS data shows it has more than doubled. It is now 127% right, NHF 3 and 4. And there are studies which says that India will have 27 million obese adolescents by 2030. So it is a time when all of us should wake up and we should create awareness in the society. So you can just
We'll discuss all that. You just give statistics, and I request all the panelists that have really made a lot of efforts, and I want to so speak what is written so that we are able to convey it. That's my first message. So you want to say that both adolescents, boys and girls, rural or urban, and 2030, you feel 11% of the global burden is going to be from here. So Prashant, what is your fear with this? If you're saying 27 million children by 2030, so what? थोड़े मोटे ही हैं तो
Yeah.
परेशान क्यों हो रहा है?
So the burden will be more, madam. The burden will be more on the society, and these children, these adolescents will develop metabolic syndromes, insulin resistance. They will be, pre-diabetic and atherosclerosis as well as arthritis. And early NCDs will be there. So we need to wake up. Fatty liver, there will be hypertension, dyslipidemia, and this PCOS in the adolescent girls. Already it is on rise. Yesterday also we had a talk on this. And of course, depression, bullying, poor self-esteem, and there will be, it may lead to even violence in the adolescent, what we are listening nowadays in the school. And heart disease definitely will go on high. And this will indirectly or directly affect the workforce, the quality of life, quality of work. So an obese teen is a very, very high risk adult in the making.
So well said. So well said, Prashant, that ultimately it is the national country also is going to be affected. So if you see a boy whose father is diabetic, mother is obese, and spent evening games and snacking, etc., how do you weigh this genetics plus the environment now that the child is living in an Indian adolescent?
Yeah, this will be cumulative effect. cumulative effect on the chances of obesity. Dietary transition, we are all see now Swiggy, Zomato, and many what not. So from Indian tradition diet, now we are shifting to the Western culture of, pizza and other thing. Sedentary lifestyle, both parents are working parents. Grandparents are not ready to take the responsibility in many places. So the children are just watching TV or some mobile or anything sitting on the sofa. Socio-economic status is definitely it has improved. Even in poor, what we call urban poor, what's happening? They are just giving some money and the child is going and buying something and eating. And he is also on the screen. So the socio-economic status, not that it is low, even in low socio-economic status, obesity is on the rise. And parental factor, what we discuss, because of the, women right, women empowerment, working women, and nuclear family, they are also leading that nobody is cooking food, they are just ordering food from outside. When you come to home, when the mother is coming home or father is coming home, already food is there. The child says, Papa, I don't need any food. I have already ordered from Swiggy and Zomato or something else. So that is one very, very dangerous factor, which is this leading to obesogenic environment. And of course, pollution. This pollution is again one of the very, very important factor, madam.
Yeah, there are a lot of papers which are now coming about the environmental roles in terms of this. So I think what we need to remember now is that two facts which we understand, that obese adolescent is going to be an obese adult. And not only that, if you want to start early, look at 3 years. If you find a child 3 years obese, then that will increase the risk of that child becoming overweight or obese at adolescent. And this was a beautiful meta-analysis I looked at. There were 2 lakh participants, and it was found that obese children and adolescent are 5 times more likely to be obese adults, and those who are not obese as compared. So that is a huge data which emphasizes what Prashant is saying, that if you don't work here, it is stupidity to work and spend all your money in the risk factors, whether it's liver or heart in adults. So Sulba, he mentioned about metabolic in his presentation when he was saying that risk increases. What exactly do you mean by metabolic syndrome?
Thank you, ma'am. Thank you for the opportunity by AHA. Metabolic syndrome is a cluster of conditions which going to lead to increase in the high blood pressure, high blood sugar, and the high serum triglycerides level, which are not good for the condition, and the central obesity or the abdominal obesity is associated with it. All this is going to disrupt your pH active, means HPA axis, so increase cortisol level, increase central obesity, coronary heart diseases, type 2 diabetes, physical inactivity, and aging. All these are related with metabolic syndrome. Thank you, ma'am.
So this is very interesting, as you can see that you need not have one when you talk about this syndrome. And me being a liver specialist, I always like to say, and the latest research is saying that the whole thing starts from the liver. If you see statistically, diabetes is also related to a bad liver. So it is the liver which is not able to take care of the fat and the sugars, and the insulin resistance starts, which will be some other day. I'll talk about it. So what are the physical and mental health consequences of your metabolic syndrome?
In the physical consequences, this metabolic syndrome can cause type 2 diabetes, then like liver disease, as we have mentioned, metabolic associated steatotic liver syndrome or diseases, or non-alcoholic liver syndromes. Then this can cause hypertension and dyslipidemias, where the triglyceride levels are increasing. That
So
to be
30%
LDL levels.
almost.
There is 30% prevalence needing for the screening. Orthopedic issues are coming, and rise of PCOS in the girls, 3 to 11% prevalence of rising PCOS. And India has already become the second largest country with the obese children, obese adolescents in world.
So that's a huge data. You showed us that almost 46% of the obese adolescents can develop metabolic syndrome, and almost the same 40% are developing liver. So it's going hand on hand, your metabolic syndrome, your liver disease. Of course, polycystic is 10% and the other, but that's a mind-boggling statistics you've shared.
Yeah. You all are watching everything from last 3 days. We are seeing about the depression, 32% rise in the obese children. Anxiety and low self-esteem is rising, and it's worsening, and it's giving more stigma and teasing to the children. Internet addiction is increasing, the obesity is increasing 24.6 prevalence in the obese children. Cyberbullying, we are seeing it amplifies as the weight gain stigma and social withdrawal so that they can go for the antisocial activities. Eating disorders, binge eating can cause obesity, and that can lead to metabolic syndrome again, and it worsens the obesity. And the high risk group are the LGBTQ, and these people face more challenges for doubling the stigma and higher mental health issues actually.
I think two key messages I want you to take from this slide. Just look at it. 25% internet addiction versus 11%. So that becomes a vicious cycle. And I have a very dear class friend, and her son was, you know, an adolescent who had tendency towards uh, LGBTQ, and he was not able to adjust at all. She being a pediatrician, so this becomes a very big issue because they have the stigma. Those boys are not able to talk to others, that they actually like to play with another boy, because it's usually at that time they identify. And you as pediatricians, she rightly said that that's a very high risk group, that you need to look for both mental and the stigma. Thank you so much, Sulba. So what is so special about Indians in this scenario? I mean, when you talk about all this, are Indians more at risk as compared to Western?
If we say, ma'am, we compare that the Indians are becoming, they are slimmer, which we see in the ancient age. But here, Indians may have more than 3 to 5% more body fat. At the same time, they have more at the same BMI as the Caucasians. The central and visceral fat is increasing in Indians because of the metabolic disease with normal BMI. Low birth weight babies with rapid weight gain have higher insulin resistance by the age group of 8, what we have seen in Barker's syndrome. It indicates early life origin of the obesity and chronic diseases, that NCDs particularly.
So this is a very important message I want to give again. Now, the central or the visceral fat. Last evening, I was in Sonipat enjoying a neonatal neocon conference. A BMI of 24, yeah, I mean, a doctor, neonatologist from our place. And he said, I have a fatty liver. And when I looked at his posture, I mean, his third BMI was less than 24, but his abdomen was out. So I asked, do you drink a lot? He says, no, it's my diet. He was a Kashmiri guy. So what she's emphasizing is, even if we Indians are not so fat and our BMI is okay, sadly we have fat in the abdomen. And 1 in 3 who have fat there end up with a fat in the liver. And that's what is worrying me when I see children, because I don't know which child is going to have fat in the liver and which not, because that child will end up with a transplant at 40 years. So our focus should be the infant nutrition and growth monitoring, because if you don't look at that, your preventive measures and all must start. Because I gave you a message, 3 years if you're obese, you will become an adolescent obese. And if you're adolescent obese, 5 times more risk to be an adult obese. So that is our focus as important message. Prashant, we do see a child sometimes in the OPD who comes who's fat, and he comes to me with pain abdomen. But when I keep looking at his history, I realize he's snoring. Should I get worried when a child tells to me snoring besides thinking about adenoids? Is there anything else which I should worry
Thank you, ma'am.
and do more test in this child just beyond, like an X-ray for adenoids? Is there anything more?
Yeah, what you told, ma'am. Today, our pediatrician friends, most of them, when the child snores, they send to ENT. Just do a X-ray and they said. But basically, we should be very, very aware that a child, if comes to us, we should not miss that, and we should plot everything in the chart. And red flag signs. Snoring is one of the important red flag sign of overweight and obesity. So we should not miss that. And also, if a female child is there, adolescent, so her menstrual history is very important, as well as family history of any parents suffering from any, high risk hypertension or, any liver diseases. So we need to screen. We should not just leave the child by counseling, but we should also do some investigation, lipid profile, ultrasound for the liver to rule
And
out
also,
fatty liver.
sorry, pelvis.
Yeah, and of course the sugar, RBS, FBS, we need to do that. So this is very, very important thing.
Somashekar, so they've talked a lot. Now, you will find a child who comes 13 years old, BMI is close to 30, equivalent of the adult that you have the growth chart, which Vijayji will talk soon. So now you know this child is obese, but you identify red flag signs of depression during the history. So my question is very specific to you. How should you balance diet, exercise, psychology? When do you want to consider medicine? This is a situation which is added depression in that girl. How do you address this child?
Thank you, Dr. Nirama. This is a very specific and very important. And once again, I thank
Keep it
AHA.
close to your
Yeah.
this thing. Yeah.
Very important is, let me talk about before diet. It's a counseling is important related to diet as well as for the about its obesity also. Coming to the diet per se, we'll go to the counseling later. But what you should do is select the food which they are used to it. That is important. And tell them, we are regularly telling everybody whether obese or non-obese about avoiding all the junk foods, bread, pasta, all those things which we are unable to succeed. And as well as tell them, let it be practical. Let us have a plate on our table with the where models comes where they cut a lot of fruits and vegetables, excluding sometimes potatoes. That's important. Advise them to take low fat diet. Give them the fat diet, give the recipe where they have low fat diet, which is, they should be palatable. That's important. Avoid sugar drinks. We should not be a role model to take the drink. One of the ENT surgeon was telling not to drink the drink, and he was in the opposite shop, he was drinking. We should be a role model and avoid sugar snacks, everything. Once in a while in the festival, that's okay, important. And all the diet should have a fibers. That's important. In that, whole grains and seeds and legumes and all those things should be added. And easy protein should be given a lot of importance. If they are non-vegetarian, encourage them. And as well as fish can be added, which is very friendly, healthy, and it's good for heart. And regular breakfast supports metabolic regulation. That's important. But we see that adolescents miss the breakfast. That's very important. This is about the diet. Simple rule is 5 or more fruits or vegetables. That's important. 2 hours of less recreational screen time. As somebody is going to talk about, important is 1 hour of physical activity and 0 sugar drinks and more water and low food. What happens with this thing? On the first day itself, they'll feel they're good. They can take a decision. By 4th week, somebody will recognize that, okay, you're reducing, you're looking good. All those things comes, definitely. But for this, targeted weight control is there. But when you're targeting, means today you should not overdo or underdo also. Make it sure that you have a target of 0.5 to 1 kg reducing the weight per week, and have some regime, like 150 minutes of per week of some walking or moderate intense exercise, or 250 minutes per week. Either of you take it, means to say you can take 30 minutes of work or 50 minutes of walk per week, means 515 to 3, that becomes 150, or on 2 consecutive take a rest, or you make a regime important, or whatever other way, swimming, exercise, dancing, all those things are, but there are come to moderate intense exercise. But when you are talking about obesity, it is not that we are going to succeed with one counseling, one diet chart, one exercise. Psychological effects are important. When you are talking about this, what happened, this altered dopamine pathway is there, increased cortisol will be there, less altered dopamine pathway will be there, all these things adds. But important, what I want to say, it's an inflammatory pathway. Don't forget that, because we are talking about the inflammatory disease. When you're talking about the counseling, have a reward system. Let it be like, they'll have adapted already to the alternate pathway. Make sure bring them to the orientation. That rewards and like give some affirmation, give some reward, be with them, have empathy, be a good listener, avoid confrontation. That's important. But when it comes to cascade, it is not obesity. It is all the red flag signs you should understand. Already in this case, depression is there. And along with that, other comorbid conditions there. And along with that, obesity-related disorder, anorexia, all those things are there. That's very important. When it comes to overall, think of their personal factor, social factor, family factor when you are treating this patient. And important is do the clinical assessment. exclude comorbidities. Always comorbidities should be excluded, and red flag signs should be immediately referred. When it comes to depression, I'll be hesitating to manage this patient. I'll take the help of psychiatrist. That's important. As I said, psychological this thing is support is very important. Counseling, that is repeated counseling. Give the time for them, be with them, and have a motivational inspiration should be there rather than anything. This is about overall about this thing. Counseling, as I said, this technique is important. Suppose a child comes that he'll tell that affirmation, give that is you are listening to them. Give a affirmation that you are listening to them. When they have something negative word, come to their negative end and go to the positive end. That's important. I'm too tired. They may say that, yes, yeah, you're tired, but your words can add little more. That kind of word or counseling is very important. And give the summary and have a structured counseling sessions so that they'll come out of the whatever the depression. Here, the case of depression, take the psychiatrist help and you be a good counselor. That's very important.
So I
always-
think
yeah, I want a psychiatrist.
thank you so much. And this part which he said was so important. When I was recently in an international conference on pediatric gastroenterology, hepatology, nutrition, there was an entire session which spoke only about what exactly is going wrong. They have that disordered eating, and the percentage of that is huge. So all this what he's talking about, the pathways, dopamine, only this slide there was a 40 minutes keynote address by an expert who has done so much of work on it to understand what goes beyond the eating. It is not so easy just to say, like, I think uh, uh, I get to see a lot of obese patients, and I'm going to share my data 2 years what we did. It is not easy to deal with a patient, and I want an audience poll. So there is a beautiful ICP has started a mental health project where we want. Why did we start? Do you know the statistics of India, the psychiatrist for patient ratio? And the psychologist, oh, I have Geeta. What is the ratio of a psychologist or a psychiatrist for the population in India? Per? No, 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 no. It's in lakhs. It's pathetic. That's what I wanted to. What you are saying is physician. I'm not asking physician. I'm asking psychologist, psychiatrist.
Yes.
So because of that, it is time now you all have to take the role. Not only this, I was last 2 weeks back in USA where I was talking to a child psychiatrist, and she says, I fail to understand why the pediatricians have to refer all this. We have so much of our work we are not able to cope up. They have to look after inpatient psychiatric patients and the florid cases. So they also expect that even in USA, that you all need to time to take. So my poll to you all is, now in the ICP that course, mental health 40 or 50, how many can I wiki train in a year? That's nothing, peanuts. Do you think there should be more sessions online where if we teach pediatricians online counseling? You raise your hands, how many will attend? So if you attend, we will request one of the team members, Chalani is doing this, because I can't spend conferences and money. We want digital way of teaching you all counseling, and when this session starts, please join. It gets very embarrassing because that is the only way. And when you learn about counseling, it's not easy. I am ADHD. I mean, I want everything very fast. Because I want everything very fast, when I speak to an adolescent, I can't be like this. Just now, he started that breathing exercises, Dr. Nishal. So to deal with an adolescent, I have to do the breathing before I know I have to talk to them. You understand? You have to be so cool. You have to be so quiet. You don't have to be yourself. You have to wear another. And that is why when they teach you, it's not so easy. And it is time when you all need to understand this. That's my message I wanted to give. So my audience poll is to ask you, what strategy do you find most practical in your practice, whatever you suggest? Is it nutrition? Is it exercise? Is it screen control? Is it parental counseling? यार ये तो बड़ी स्मार्ट ऑडियंस है. So when it is that, that is the thing that we need to explain them. एक और एक दो नहीं, एक और एक 11 होंगे. So that is the role. And there was a beautiful study in this. They were a cohort of children who lost weight by diet. There was another cohort who lost the same weight, but by diet and exercise, right? And the liver disease, the fatty liver disease, disappeared only in the exercise group and did not disappear in this group. So it becomes very important to say this. Okay, Vijay ji. So अब लोगों ने आपको बताया कि इतना हमारा प्रॉब्लम है, 29 मिलियन 2030 तक आएंगे, हर पीडियाट्रिशियन को ओबेसिटी सीखनी है. इसने बताया आगे जाके मेटाबॉलिक होगा एंड 50% को हार्ट, कार्डियक, लिवर प्रॉब्लम हो रही है. अब आपके पास एक आम any child who visits to you in a OPD for vaccination, आपको थोड़ा मोटा दिख रहा है, माँ भी मोटी दिख रही है, तो क्या अप्रोच रहेगा आपको?
See, we all have to sensitize about obesity. See, genetically, we pediatricians are sensitized to see the malnutrition, because in a medical college, we are taught more about malnutrition. So we have to see for the obesity, and for that, like we have to plot on chart weight, height, as well as BMI. There are age, weight specific BMI charts available for males as well as female, as is published by the Indian Academy of Pediatrics in 2015. We have to use it. Now, we all know that abdominal obesity, that is the central obesity, gives rise to all cardiometabolic problems. And that's the reason why, along with this BMI chart, we have to plot on waist circumference chart also. And that's available for 5 years to 17 years for male as well as female, as is seen. Now here we have to remember that usually more than 90th percentile for age is considered as high waist circumference, but it is actually in the Asian population and Indian population, we have to consider it as a 70%, because abdominal obesity is more in Asians as well as Indians.
So the Asians cutoff also for adults are different. What is for women? 85 or 90? 85. So even you all have to check your waist circumference. It gets so very important. I was talking of the neonatologist yesterday. BMI was 23. He had fatty liver, but his waist circumference was definitely more than 90 centimeter. So that is, and I've downloaded all these charts from IIP website. So I want all of you all to put your hand on your heart, and say, I pledge every child I'm going to put a growth chart. कितने भी पैसे का print out लगे, every child I'll put a growth chart in the prescription. You know, it's like कंजूसी की भी हद हो गई, because we are all digital. We are all digital. मेरे residents सब सेंटाइल लिख देते हैं, मगर ग्रोथ चार्ट कभी नहीं डालना चाहते. मैडम लिखा तो है सेंटाइल. मैंने कहा हाँ भाई तूने लिखा है, लेकिन पेशेंट को दिखाने में इम्प्रेस में वो उसी से कर पाऊंगी ना. I can't do it because one thing is not going to affect. For example, you see a photo of me with Dawood and you'll say, wow, she's standing with Dawood. But how do you know actually he was just driving down and you took the photo वो जब ऐसे जा रहा था और मेरे सामने. So you need an entire scenario of what has happened. So I see a child with third centile, but he was always third centile. How do you know that? So it gets very important. And besides that,
Yes.
any other thing you want to talk?
Yes, then I will ask mother regarding her pregnancy, and will also guide her for the future pregnancy,
Exactly.
because Yes, this obesity starts from the pregnancy during the fetal life. Even before that, before antenatally also, if mother's BMI is more than 30, then she is more likely to deliver a baby who is obese, more likely that that baby in future grows as an obese
सो ये दिल
individual.
मांगे मोर, मैंने आपको बोला 3 साल पे ओबीस है तो अडोलेसेंट होगा, प्रशांत ने बोला कि अडोलेसेंट अडल्ट, सर तो अब माँ पे घुस गए कि अगर माँ ही मोटी है तो बच्चे भी होंगे, तो अब वहाँ पे भी आपको काम करना पड़ेगा। विजय जी,
Yes.
और मैसेज इज क्लियरली
Yeah, so
टेकन।
yes. So mainstay. So we have to counsel about about the mother to the child, and mainstay of prevention is balanced calorie intake and expenditure and healthy lifestyles. And you see, actually everything rotates around family rather than an individual child. If you just tell the what you should do for the child, it's not enough. The child is not going to follow it. You have to tell to the whole family, parents, siblings. We have to take care of them. And so, food behavior counseling of the whole family is the most important. We have to give them the advice about the diverse group of the food as per the recommended dietary allowance. My plate concept is very important. Photographs was shown. There, they should not consume any added fat or trans fat. And very important, sugar should be less than 5% of the total energy. Junks to be avoided. We keep on talking about the junks day before yesterday also. Junk means junk food, ultra processed food, no classification. For food, caffeinated, colored, carbonated food and beverages, sugar, sweetened food and beverages. Avoid fast food. See, one fast food meal is going to give you 2000 calorie and 84 gram of fat, too high. Um, Adolescents are more prone to do parties, so parties should be very less, just once a month. Occasional visit to the restaurant. And see, there should be a meal time should be fixed, but it should be for a prolonged minutes, like it should be minimum for 15 minutes. The child has to chew it thoroughly. Um, this is the same. Junk food is to be avoided, and my plate concept has to be followed.
That plate concept is very interesting. Entire half of the plate is the vegetables and fruits that should be the plate depending on the age of the child. We are talking of an adolescent, and you can see how beautifully the pulses, egg, flesh food, milk, nuts, seeds, fats, oil, and the cereals, the proportion that has been given, this should be in your everybody's clinic. That should be the message that should be there.
This is also very important. We have not to force the child to complete the plate. Usually it happens that child is always advised to consume everything, whatever is there on the plate, and that's how he consume more. Uh, for a reward, no food should be given. Ice cream for doing something good, that is actually not good. Reward should not be in the form of any food. There should be no eating and drinking while watching TV. Involve children in healthy cooking and meal preparation. Authoritative parenting, we keep on listening it since day before yesterday. It's very important. A parent, they set an example and child follows. Concept of 5 to 10, that has already been discussed. Uh, s- and traffic light diet plan is very important. See, diet is divided into three, like traffic light: green, yellow, and red. Green diets are like, say, unlimited fruits and vegetables. They can take it whatever they like. Yellow, it means that limited consumption, that is dairy, starch, and grain. And red is infrequent or no. So fried food, sugar sweetened beverages, fatty meals, plain sugars,
I
they
would
should
just
not be
make
consumed.
one addition here, that when we say unlimited fruits, I disagree. This is in the IAP, so I had to copy paste the IAP guideline. But I think this needs addition, because fruits are nothing but fructose and carbs. So I always tell my parents that fruit ek ya do, go up to 200 grams. Ye nahi ki aadha ek kilo kha le. So please remember that also the hi-fi group people, they think that मतलब आधा एक किलो भी खा ले, it's like एक किलो दूध पी ले या एक किलो. So that is also wrong. That's what I wanted to change. So we are almost to the end. That Prashant, besides this, they said, what does IAP talk about screen time?
Yeah, screen time IAP is very clear that there should be zero screen time for children up to 2 years. Even only you can talk with the grandparents video call for 1 to 2 or 5 minutes. And 2 to 5 year it is 1 hour, and up to 10 years it is 2 hours. But for adolescent, definitely there is a little liberty after the COVID era that for studies and for academic activity they can see, and after that, and it includes the TV time also. It includes the TV time also. So specific development goal is there, then definitely they can be allowed, but otherwise it should be minimum.
Sulba, what would you make an effort to discuss for this child or anybody in school also? I mean, you're a pediatrician, where can you go and do? But do you think you want to do, and if yes, what do you want to do?
I would like to ask all pediatricians who are attending this conference, they should spread the message to at least 10 people around you to talk with the children about reading the labels over the packet foods, how much sugar, salt, and fats are inside the packets. The healthy, fresh prepared home food should be there. We should teach the teachers also regarding these things. The school canteen should not have any packaged food, no junks in the school or in the premises of the school, and there should be at least 30 minutes exercise daily, not only for the children, for us also.
Somshekhar, they've all talked about diet, nutrition, they said, physical activity, they said, screen, they said, school, they said. Any other thing they think you missed?
I was just thinking, we didn't speak much on the sleep. Screening time is, but sleep is very important.
Very good.
I think we should discuss, and for the adolescent, 8 to 10 hours of.
Yes. So the American Academy suggests 8 to 10 hours, and I think IAP suggests 9.
Dr.
Okay.
Nilima, when you're coming, you ask me one more question, I'll just
Yeah,
answer
so
it.
I'll
Well, just
almost
coming
now
about the
I'll talk about
medications.
this boy, 10 years old, who comes to me with pain abdomen, mostly in the left hypochondrium. His weight was, please look carefully, his weight was 77 kgs. And he had acanthosis nigrans. You can look at him, central obesity, and late child parents had the child in late 30s or early 40s. And his liver enzymes were ranged. They were 300s. I repeated after 2-3 months, 300s. I repeated again. So over 3 months, it's going. Vitamin D was corrected. Sugars, thyroid, etc. was normal. So we do the ultrasound and fibroscan that showed the CAP 335 means fatty liver, and KPA 7.6 means that the liver is getting fibrotic. That scares you because it should be less than 6. And his autoimmune marker was positive. So I went ahead and did a biopsy. And can you believe that? 50% of his liver was fat, and 3/4, I repeat, 3/4 of the liver was already fibrotic. So this, you could have never imagined a 10 years old boy with that fibrosis. So 15 years, he will get into cirrhosis. Late 30s, we get transplant. And I'm not lying. I work in a transplant unit. We do 300 liver transplants annually. 300. Children are 45 to 55 a year. But in that, what I'm seeing in the young adults, 40s, they're all NFLDs, NASH. And these are the kids who were actually missed by you all. So the overall prevalence of fatty liver disease is very high. In obese, it is as high as 55 to 80%. So we used to say 15. These are the studies from India. Rural, just school-based studies, even an ultrasound showed 10 in 7 in rural and 22 in that. And other studies also came from Delhi and NCR, 20 to 35% fatty liver in obese children. And this is my data. We publishing has gone for publication. 150 children who came to me in OPD, for, they were obese, that's all. And they came to me either for pain. Some of the parents came to me and 22% said mota hai. So I really appreciate only 1/5 parents came for that. Some came with abnormal liver enzymes and the rest non-specific constipation or whatever. And please look at that. The liver enzymes were abnormal in 42%. Fatty liver was seen in 90%. Fibrosis was seen as early as 10. The child I showed you biopsy. So this child, when you worked with all what Somashekar talked to you about, we worked in that style, means exercise, nutrition, counseling, all what you said we do. He came to that within 6 months and his liver also improved. So your role is early identification. Vijayji emphasized that please monitor the charts, and he also said waist circumference you monitor, and counseling was something which Somashekar emphasized, and you need to collaborate with your psychologist. And Sulba was trying to tell us that let's go into public advocacy. So there is role in community, government, regulatory agencies. Shortage of time, I'll just go through that. Sulba, quickly tell what a community should do nowadays. You don't
Ma'am,
have gardens.
before community, I want to appeal IAP that they should have a say in the government regarding the child nutrition.
No, community first
Yeah.
you tell me.
Exercise sports should be there in the community. Bicycle, walking, jogging tracks, fast food centered should be discouraged. Walkable school bus and walkable community should be there. Fund the school, finance the food industry, and budget for bicycle, jogging, walking park. Allow tax deduction for the weight loss and exercise program. Ban advertise on the fast foods, sugar, sweet and beverages, non-nutritious food at the preschools. And the children program should have restrict program regarding the nutrition. Increase the nutritional education programs more based on the school education, and the green light and red light label on each
How
food should
many
be
of
there.
You all raise your hands, live in not independent house but in community. मतलब फ्लैट्स में या इंडिपेंडेंट घर, सिर्फ 8 लोग ही रहते, बाकी के सब इतने अमीर हैं, बड़े बड़े बंगले. हाँ हाँ, तो फ्लैट्स में खड़ो करो ना, करो भाई, बड़े अमीर लोग आ गए हो, थोड़े पैसा डोनेट करो मुझे अगले साल के लिए. तो आप पहले ये करो कि जब when you go abroad, don't you see free cycle पढ़िए, ये सब पढ़िए, मतलब यहाँ पे तो चोरी हो जाएगी, ये हो जाएगा, all that is there. But I think you all can start by talking once in 3 months कि आज community का lecture लेंगे, something like that. That is what you do. And no sugars in early childhood, because क्योंकि उन्होंने pregnancy का, मैं थोड़ा पीछे मैंने कहा early childhood से मना करो. So you all agree, fit child and fit India, because my panelists showed you that not only the pediatrician is the culprit, sorry, because 3 years पे मोटा हुआ, फिर adolescent हुआ, फिर वो adolescent pregnancy में हुआ, फिर एक और मोटापा हुआ. So the whole cycle they've impressed you, and they impressed you that early recognition, community awareness and that. And I think my role in IAP would be to work on the national awareness on this and the modules that we are creating with experts sitting around with me, collaborations with school and public advocacy. All that I request you all again to pledge. Put your hand on your liver and your heart. Both liver and heart, and say that agle saal, please say agle saal, nutrition में तहलका मचेगा और हम सब करेंगे. I can just get you all, I've already arranged 2 CR funds for nutrition पे काम करने. But it is not M, but it is W, it's we together. And everybody, we realize all of you are nation builders. If you want to reduce the sapna of Modi ji ki bimari kam karo, to unhe bolo, sir, udhar kya dekh rahe ho, idhar dekho, pediatrician pe, namo ko bolo, nimo ki taraf dekho. Thank you so much, my dear panelists. A big applause
Three,
to
three,
them.
three cheers for Neelam madam. She is a
And
icon.
three
She
cheers
maintains the
to-
best physique. So we are really proud that our incoming president is maintaining such a nice figure so that all of us are now motivated to do lot of exercise and eat less.
So
thank you.
Thank you to Sushma,
Thank-
Nishal, Jagdish, Sameer, Kiran, Manish, Prashant, and the entire team. Thank you so much for having us over.
Thank you.
Sir, since 2 days we are
Sir-
seeing it.
सर हम आपको नई शर्ट देंगे नहीं हम ये शर्ट नहीं हम आपको और अच्छा काम देंगे आप बहुत पोटेंशियल हैं सर आप में एंड आप भी अपने हार्ट और लिवर पे रख के हाथ कहें कि महाराष्ट्र में तहलका मचाएंगे मैडम के साथ राइट थैंक यू बट वी हैव टू वर्क अगर हम 6 चीज पे काम करेंगे ना तो नहीं हो पाएगा सोशल प्रोजेक्ट एक लेना पड़ेगा एक लेना पड़ेगा
You are coming as a president-elect. So now we need a we need a paradigm shift in our approach at school level because the birthday boy, he distributes chocolate. The mischievous boy, he is made to walk or run 5 times or
Arey.
6 times in a school. And a boy who comes first is rewarded with chocolate. So we need a paradigm shift. The boy who comes first should be made to run around the school for 5 times.
आपको मैंने फोन
And chocolate should be used as a punishment.
और आपको मैंने फोन किया था एक दिन और कुछ काम दिया था
वो आगे जाके
भूलना नहीं
नहीं थैंक यू सो मच
ECG बल्ब लाना भूल मत जाना so he is going to be very responsible for ensuring we're doing a lot of all of you I don't know you saw before I finish I had sent a survey 2 times जेब से पैसा खर्च के ब्रिवो ऐप से 98% डिलीवरी आपके मेल्स पे 4th to 7th में मेल गई from me which said Dr. Neelam President 2026 and I sent you a Google chart what is your dream what change you want what action plan you want सिर्फ 150 लोगों ने जवाब दिया and all those 150 log will get position wherever they want but I insist you all to go back go in your junk in the junk 4 to 7 के बीच में 2 mails आई हैं 98% delivery rate please see please fill that form that Google form is telling me कि आपके बारे में tell me that means what is your education what is that maybe मैं talk इसको दे दूँ and she's not so smart as she I don't know so unless she sends me a Google form saying I have done this my publication is this then that's how the pedicon can be more sensible and then please you Nishchal has taught us gratitude I'm making load of efforts from March on pedicon loads of effort but I can't be still perfect and सबको खुश कर पाऊंगी still I want you all to tell me what you think is that you need in that but work in social projects too with us because pediatricians are into advocacy and as you can see I've gone in completely advocacy at this stage of my life
Thank you, madam. So just to conclude, the
and
madam,
डॉक्टर साहब कुछ पूछ रहे थे
Sir, madam, I think
after
pediatric friendly growth charts are there. In busy practice, you don't need to calculate BMI. Just go on plotting the weight height, you get the level of the obesity. That is the easiest. Our IAP has got those growth charts.
Ma'am, IAP has one IAP growth chart app that I'm giving
मैं
free
वही
to
डाल-
all the patients. And that is
No,
very
I'm
easy
telling
so that
the-
they can monitor their own child growth.
No, that is there, but pediatric friendly growth charts are very helpful for obesity. What is
ये
the
वाला
level
बोल-
of
अच्छा ये
obesity?
दिख नहीं
It
रहा
is
है,
also
sorry.
available, yes.
It's available.
okay, thank you. So
louder sir pancreatitis yes so you were smart enough to pick up those 3 that I said so gallstones and pancreatitis all are a part of the effects that you see when it comes reflux disease dyspepsia constipation gallstones biliary sludge is there pancreatitis and the worst part is अगर pancreatitis हुई, I have data of 750 children. It's going for publication. Over 25 years, I mean, 25, 30 years, जो भी थे, is the obese have highest morbidity and mortality. If we have severe pancreatitis, if you lose a child, it is only an obese child who you lose. So it is very important in obese because clinically आप वो tenderness और वो feel नहीं कर पाते. So
I think
whenever you
we are
find
running
a
short of
obese
time,
child
madam.
with pain, keep a low margin on pancreatitis.
Yeah, sure.
Excellent question.
And just
We have
to,
already shoot the 15 minutes over normal time. Please complete.
थोड़े से तालियां हमारे chairpersons के लिए.